stigmatization has to do with ignorance, because if you know about what actually brings about the cancer and what goes into it, you will not stigmatize.
Okay. October is here with us again, and as you all know, it's a month dedicated to create awareness on breast cancer. Today on my channel, I'm privileged to be interacting with someone who is at the forefront of the fight of breast cancer and also of the treatment of breast cancer as well. She is a member of the Breast Society of Ghana and also a resident oncologist at the National Radiotherapy and Oncology Center at the Kolebu Teaching Hospital in Accra. This center is one of the 3 centers in Ghana that treats clients with all manner of cancers. And this center also is internationally recognized because it gets referral from other neighboring countries, from even as far as East African countries. It is also a teaching center that trains oncology doctors, oncology nurses, radiotherapists, and also medical physicists. I want you to stay with me as we go along.
Medcare Hub.
My name is Elsa Salina, and my guest this day is Dr. Juanita Brehua Nkansah. I hope I got the name right.
Yes, you did.
Yeah. You're welcome to Medcare Hub. I want you, since you are a female doctor and at the forefront of the fights and treatment of breast cancer, I want you to just explain to us what breast cancer is.
Okay. So basically, breast cancer is cancer of the breast.
Okay.
So when we say cancer is a disease that affects the body when you have what we call genetic mutation. And what happens is that the cells of the body undergo cell division. And in this cell division, there are checkpoints in place to ensure that the cell undergoes successful cell division. So these checkpoints ensure that the cell has everything intact with respect to the DNA, with respect to the organelles. So if there's a problem at these checkpoints, we call it genetic mutation, then you have these cancer forming. So that's what usually brings about cancer. So when you have this cancer occurring in the breast, then you have breast cancer.
Okay, so these genetic mutations can also take place in any part
of the body. Any part, it can happen in any parts of the body.
Okay. So in Ghana, what are the current statistics of clients having breast cancer?
Okay, so according to WHO, worldwide, actually, when you count 8 women, you have 1.
Wow.
One will get breast cancer or is at risk of getting breast cancer.
Okay.
At our center, at National Center for Radiotherapy, Oncology and Nuclear Medicine, as of 2018, we actually recorded 425 new cases.
In that year?
In that year. New cases.
Wow.
Old cases were not bad.
Oh, that's interesting.
2019, we recorded 521. 2020, we recorded 527.
That's alarming.
2021, we recorded 607. And already this year, we are around 300 to 400 new cases.
Wow.
All these I'm saying, they are new cases. And it's just with respect to our center.
Okay.
Surgical statistics, it's not part. Kumasi, that's from Fanoche, is not part. And SGMC is not part. So these are the current statistics of numbers arising. And usually our numbers go up after October because of the screening. So from November, December going. So we are expecting that the numbers will rise after, will rise above the 400 after this October. So yeah.
Well, listening to you, could say that from 2018, there's a steady rise in the diagnosis of breast cancer, and that's alarming. What are the measures that have been put in place, maybe by the Ghana Medical Association in curbing this cancer in women? Can you tell us something? Because it looks like every year, though we give education and there are there are measures that have been put in place, the number keeps rising. As a doctor in the forefront, what can you say? Because the figures are alarming. So something to just tell us what's going on.
Okay. So with respect to the measures that have been put in place, the truth of the matter is we don't know the exact cause.
Okay.
Before you can actually eradicate something, you should know the exact cause. Like malaria, we know that it's from the female anopheles. But for breast cancer, we don't know the exact cause. So it's the risk factors that we usually talk about. Because for the risk factors, we have modifiable and non-modifiable. The modifiable means that there is something you can do about it. And the non-modifiable is like there is nothing you can do about it. So, I mean, this question brings us to the risk factors then.
Exactly.
So for the risk factors, majority of the risk factors, it's concentrated on a hormone called estrogen. So this estrogen, when someone gets exposed to it for a long time, then you are at risk of getting breast cancer. And it's a natural hormone in the body. Actually, God has made it such that, let me put it in layman's terms, it makes a woman a woman. So when you see that a child is born, apart from looking at the private part to know that this is a male, this is a female, you won't actually know. If you go and see a child wearing an overall, you won't know. You may have to ask their mother whether it's a male or a female. But when they get to the adolescence, you see that some developments begin to occur. They begin to get breasts, they begin to get shape and all that. So when you see a female walking, you don't have to ask. You just know that this is a female, and it's because of this estrogen. Actually, So when a girl begins to menstruate, then the estrogen level goes up. But then after menopause, the estrogen level goes down. So then the risk factors include early menarche, if you begin to menstruate early.
So before you continue, is this the modifiable or the non-modifiable risk factors? What you are going to talk about?
So I'm going to put everything together. I want us to understand where the risk factors are based. Then after that, I will separate it. If I separate it from the beginning, we may not understand the
Please don't go anywhere. Don't touch the dial. Just stay tuned, because she's really going to give us all that you need to know. She's going to break all the myths. She's going to tell us everything. Now we are on the risk factors. Just stay tuned. I know you are enjoying this video.
Medcare Hub.
So when someone menstruates early, we call it early menarche, before the age of 10 years or before the age of 12 years, you are at risk. Because like I said, the estrogen level goes up from adolescent when you start menstruating. So, and then if you don't get pregnant at all, because during pregnancy, we all know that the menstruation doesn't occur during that time, and also when you are breastfeeding, especially in the first 2 years. Specifically when you do exclusive breastfeeding in the first 6 months, a lot of women will confirm that they don't menstruate. At that time. So the estrogen levels are low, especially when you breastfeed in the first 2 years. And if you have what we call late menopause, after 55, after 60 years, because like I mentioned, the estrogen level goes down after menopause. So, and if you don't breastfeed
at all,
then, or you don't breastfeed within the first 2 years, then of giving birth, of course, then your risk is also high. So there is also increased BMI, obesity. So what happens is that especially after menopause, the body converts the excess fat into estrogen. So then that also increases your chance or increase your risk of getting breast cancer. And then alcohol and smoking, they contain some chemicals, we call it carcinogens. So these carcinogens cause genetic mutation that increase your chance of getting cancer. And of course, if you're a female, because like I said, it's what makes a female a female. Men too have estrogen, but it's very low. Their main hormone is testosterone. And the risk is also higher in whites as compared to blacks. Yes, and also when your age is increasing after 50 years, the risk is high. So then let's look at these things that I mentioned, those that we can do something about, those that we cannot do anything about. So looking at those that we can do something about, breastfeeding, you can do something about it. So when you give birth, you have to breastfeed. If possible, and you can, you have to give birth. And also, you have to check your weight. So by exercising, by eating healthy fruits, vegetables, and all, so that you try and contain your weight within the normal range of the BMI. You have to also reduce or stop alcohol and then smoking. And also, I forgot to mention, as part of the risk factors, giving birth to your first child after 30-35 years also puts you at risk. And also, there is some medication, we call it hormone replacement therapy, especially the estrogen only containing one. So you don't have to just be buying any medication, especially the hormonal ones. It has to be prescribed by a doctor. And also, if you can, you should give birth before 30 or 35. So these are something you can do. These are the things that you can do something about. But the things that you cannot do anything about, like your age, I mean, you can't do anything about it. Being a female, you can't do anything about it. Being a white or a black, you can't do anything about it. So and also, as part of the risk factors, if you have family history, if it's in your family, you can't do anything about. So these are the modifiable and then the non-modifiable. So back to the question on what we are doing to curb this. We are emphasizing that the things that we have to, you can do something about, you can modify it. You have to modify those lifestyle changes, so that we reduce the risk for breast cancer.
In your the modifiable risk factor, you talked about not abusing over-the-counter hormone replacement drugs. Maybe you can mention, but what are these pills? What do they do? Like, why do people take those hormone replacement drugs?
So initially there were some contraceptives that were estrogen only pill, but now they are out of the system for contraceptives. So, but now most of the time they are combined. The combined one doesn't actually pose the risk for breast cancer, but it's the estrogen only pill, which now it's hardly in the system. But also, after menopause, there are a lot of changes that occur, the hot flashes, and a lot of women, sometimes it's so unbearable for them. So they go in for these pills that help ease the symptoms that they are having, but then it may also increase your risk. So instead of going to get it over the counter, it's better you go to the hospital.
So it means that you are exposing yourself to a lot of estrogen hormone by taking this.
By taking it.
Wow, that's interesting. I'm really learning a lot.
So for someone, for example, if you are already at risk for breast cancer, the doctor may have to evaluate, weigh the risk and benefit before deciding whether they will put you on that.
So talking about the hereditary, how close is the relation? I mean, if what's the closest relation to having breast cancer? Or let me frame the question. Really, among your relatives, how risk are you by having a close relative having? I don't know whether I'm trying to. We have a lot of female people in your family, but some are distant, some are close. So, at which point are you at risk among your family circle?
So usually the maternal history, for example, your mother, your sister, your auntie, but I mean, that notwithstanding, it has been shown that it's less than 10% of breast cancer cases are linked to family history. Now most of them, it's not linked to family history.
So can you have somebody not being exposed to any of these risk factors? Maybe let's say 1 out of the lot having breast. If the person doesn't have a family history, doesn't smoke, has breastfed kids, maybe not 2 years, but at least for the first year and a half. But some, do they have breast cancer like that?
Because we don't know the exact cause. These are risk factors. So you may have all the risk factors and still not get it because it's a risk.
Okay.
Yeah, you may have none of the risk factors and you may get it because they are risk. They put you at risk. It doesn't mean it's the exact cause. Yeah, but it increases your chance of getting
it's getting interesting.
Yeah.
Okay, so I want you to take us through what to expect or what we should look out for. That's the signs and the symptoms of breast cancer. When someone has breast cancer, what should the person look out for? Or what are the things that should make you be alarmed that, hey, I'm getting breast or I have breast cancer?
So for the signs and symptoms, the common one a lot of people usually present with is a lump in the breast.
Okay.
Yeah, that's the common one. You can also have the skin around the breast becoming ulcerated, or let me say wound.
Okay.
Yeah, like as in when you grow. Yeah, and also you can have blood nipple discharge. Then the skin around the breast can look like an orange peel, like pudorange. We call it pudorange. You know, the peel of an orange has this dots thing on it. Yeah, you can have a lump under the armpits, or at the clavicle here, on top of the clavicle. We call it supraclav. Yeah, you can have. Sometimes you won't even have anything in the breast, but just a lump in the armpits.
Okay.
Yeah. So when you see something like this, you have to report to the hospital for us to examine you, and then we may request for an imaging, mammogram or ultrasound, or sometimes even both. The sure only way to determine whether whatever change occurring is cancer or not is when some of the sample is taken to the lab. We call it histopathology.
Okay.
That's the only thing that will let us know whether whatever it is cancer or not. Because a lot of people have lumps in their breast that turns out to be benign. I mean, studies have actually shown that more than 90% of breast lumps are actually not cancerous.
Okay.
Yeah, those that are cancerous are less than 10%, like 6 to 8% thereabouts.
You still need to report when you see.
Yes, because you can never tell. You could be part of the 6%. You could be part of. So yeah, you have to.
Okay.
For you to be ruled out. Yeah.
You spoke about bloody nipple discharge. What about if the discharge is not bloody? It's milky.
So even if it is milky, you have to come for us to evaluate to know. But if it's milky, we will not be thinking more we won't be leaning more towards cancer. Yeah, it's when it's bloody. But it doesn't mean that we'll not investigate. We investigate. Yeah.
All right. So that's the diagnosis is by taking the sample of the lump to the lab.
So it's by history taking, examination, imaging, and then so it's
so there are stages of diagnosis.
Yes.
So you can't just look at somebody, or you can't just say, "Oh, I feel something fun, then I have breast cancer." You have to really report.
Yeah.
So like you go through all the stages of diagnosis. Okay, it's getting more interesting. Okay, so. Now we've known the signs and symptoms, we've known about how to diagnose, then let's talk about the treatment of breast cancer. Some people say it's a lifelong treatment, others to say it's very expensive. But before we come to that aspect, what are the treatments available for someone diagnosed with breast cancer?
Okay, so for the treatment of breast cancer, all our treatments are based on clinical research and evidence. There is no single treatment that we give that research has not been done and proven to help. And we use an approach called multidisciplinary approach. So this approach shows that it's not one person or one specialty that manages. It's multidisciplinary. So it involves the surgeon, oncologist, psychologist, nurses, radiologists, pathologists. So it's a teamwork. So it's a teamwork, and breast cancer is breast cancer. So you can have two people having breast cancer. However, there are a lot of subtypes of breast cancer. So we look at all these factors. So we look at tumor factors, we look at patient factors. So it's individual based. Let me put it like that. Yeah, it's individual based. So if person A has breast cancer, person B has breast cancer, they all have breast cancer, but then their treatment is different. Patient A treatment is different from patient B.
So it's not a stranger case?
Not at all. Because we look at the various subtypes. So for the subtypes, for example, we have something like ductal carcinoma, lobular carcinoma, mixed type. We have special types, Paget, tubular, clear cell, and we also look at immunohistochemistry, estrogen receptor, progesterone receptor, KICD7, HER2/neu.
Wow.
And look at the grade, and we look at a lot of things.
Okay.
We also look at patient factors.
Okay.
We look at how old the person is, because something performance status, how the person is able to perform, go about his or her normal activities. Yeah, we look at the comorbidities. If the person has some other conditions like hypertension, diabetes, HIV, hepatitis B, what medication the patient is on. Yeah, so we look at all these things, and then we stage. We have stages of breast cancer. So we look at all these to determine whether we'll do surgery only, or we'll add chemotherapy, or radiotherapy, or we have hormone therapy, we have targeted therapy. So these are the treatment options, and we look at all these factors to determine how.
If the treatment is research based, and it's also multidisciplinary, that means that it is aimed at making sure the person lives.
Yeah.
But sadly, most people with breast cancer dies. So what makes a person susceptible to die when diagnosed with breast cancer? Because you've said about all the things that will help the person to live, but still people die. So at what point does a patient or a person diagnosed with breast cancer dies?
Okay, so in the treatment of breast cancer, a lot of factors come into play. The common one that is difficult, patients don't come early.
Okay, so late reports.
Yes, late reports. And compliance is a problem. Sometimes they will come, you start the treatment, and then they go and they don't come, because we have a lot of home doctors. At that time, we understand that the patient is confused and all that. So when you have other people coming with herbal, let's go to this prayer center and all that, so it makes compliance difficult.
Okay.
Yeah. So I mean, all of it put together, it makes it difficult. Yeah. So that's how come
to
we have
really save the life of the person.
To really save the life.
Does cancer spread?
Yes. So on the complications, that's one thing about cancer that makes it difficult to actually fight. So you can have cancer of the breast, but then it can actually spread. It can spread to other parts of the body, and then affect how those parts of the body are functioning. So you can have of the breast, it can go to the liver, and then it will affect how the liver is functioning. It can go to the lung, and it can affect how the lung is functioning. So such a person can begin to cough or have difficulty in breathing. It can go to the bone and cause bone pain, or something called pathological fracture, such that it's not that the person has fallen or has had an impact to the bone or an accident, but then it can just break. You can have it going to the brain. A patient like that can have seizures, or begin to behave like someone has a little problem with the brain, like psychiatry, excuse my language. Yeah, it can also go to, when it goes to the bone at the back, we call it vertebrae. We have the spinal cord there. So and when it compresses the spinal cord, we call spinal cord compression. Such a person may not be able to walk or even be able to move their hand. So yeah.
So when it spreads to any part of the body, there's nothing much that can be done.
I would say there's nothing much that can be done. It's palliative. What is done is palliative. It is not cure. So we have two main treatments for cancer with respect to our intention. We have curative intention. We have palliative intention. So with the curative intention, mostly when it has not spread and it is localized, yes, it can be cured. But when it has spread, in most situations, it cannot be cured. In some one or two few occasions, which is a bit complex, to go into it, it can be cured. But most of the time, when it spreads, it cannot be cured. It is palliated, meaning that you are slowing it down. You are trying to control it. Yeah, but you cannot eradicate it completely. Let me put it like that.
Thank you so much. I really enjoyed this interview. Viewers, I think the key thing is seek early treatment. That is what will save your life, because if the cancer spreads, as she said, it can spread to any part of the body. If it does, it will be difficult to save you. You might live, but will not live to the full length that God has given to you. Doc, before you go, I want you to tell us about self-breast examination. How does it help in the detection and treatment of breast cancer?
Okay, so we usually recommend that 7 days after your menstruation or 1 week after your menstruation, you examine your breast. We say that because usually during menstruation the breast becomes tender and a bit full, so it will be difficult for you to determine. So if you stand in front of the breast, the mirror, and then you look at both breasts, and then for those of us that is not so cute, it's a bit pendulous, you may have to lift it to examine the skin or the breast under, because it has folded on it. And then you also lift your hands to look at your armpits to see if there are any changes. And then if books usually recommend that you divide your breast into 4, but that usually works for those that their breasts are a bit cute, because if the breast is quite big, you can't just divide it into 4. Your palm may not be able to cover it. So it depends. So then you use the palm of, you use the inner part of your palm of your hands then you just you can hold your put your hand at your waist, and then you just touch it against, you press the breast against your chest. Then you go like that. You go like that. You go like that. So you divide it into 4 like this. So here, here, 2, 3, 4. And then the last one you have to add a nipple. So then you repeat it on the same. If standing and doing it would be difficult for you, you can, especially if the breast is quite large, you can lie down and then support it this way whilst you are lying down. And then you use this hand to press it against the chest wall. Like that. And whilst you are standing, you have to look at the nipple. Whether it is as, you've always known your nipple. So on the symptoms, sometimes the breast the nipple can become inverted. So you have to see if it is, some people have their nipples inverted already.
As in it has gone in?
As in it has gone in. So, but if yours is not like that, all of a sudden you realize that one of it is like that, you have to check. You have to look at the skin around it for the podorange, for the any ulcer or wound around it. So you have to look at all that, if there are any lumps or anything in your armpits or around the breast. Then look at if there's any nipple discharge, so any changes at all.
So with the self-breast examination, consistency is key.
You have to do it like every month after 1 week after your menstruation, you have to do it. And then every year to if you hear now, because of the awareness, almost every year there's some free breast cancer screening going on somewhere. And you can just pass there and then
they said there's no free lunch, but this one is really free lunch. I've got my boobs checked. I think you should get yours checked as well. We really learned a lot today, and I can't wait to have more of Dr. Nkansah again on my channel. If you like this video, I want to give it a thumbs up, subscribe to my channel, and stay tuned for more interesting programs this month. What are your last words before we go?
So my last words are that breast cancer is real and everybody is at risk. The part that we usually don't talk about is stigma. I think stigmatization has to do with ignorance, because if you know about what actually brings about the cancer and what goes into it, you will not stigmatize. This is time for all of us to stand up and fight, because it's a fight that we are all in to fight against breast cancer. So we have to say no to stigmatization and then stick together and fight this, because we can actually win this battle. So let's fight together. And like the Breast Society of Ghana, our theme this year is living beyond breast cancer. Together we can. It's a together effort. So let's fight this. Thank you.
Thank you, Madam Elsina, for inviting me to your channel, Medcare Hub, to educate on breast cancer. It's been an honor to be here. Please kindly subscribe to Medcare Hub. This is an all-inclusive channel that brings educative program on health, finances, parental tips, abuse, and awareness. Thank you so much. Bye.